morning. My name is Amanda Neal. I'm a adult and geriatric primary care nurse practitioner. And the Evangelist Hill, that's my aunt. She asked me to come speak to you ladies today. So, I know that you all are having a prayer breakfast today, and one of the topics is about cancer. My aunt asked me to speak about cancers relating to women, particularly minority women, meaning us, African Americans, and Hispanics. And so that's what we'll be talking about. The first one that's very important, and the two primaries that affect women of color, are breast cancer and cervical cancer. Those are the one and two cancers that affect that specific population. Cervical cancer. First of all, where's our cervix? Cervix is a part of the reproductive tract. So there's a uterus, and then at the bottom of your uterus, there's a cervix. For those of us who still have them, if you're over 40 and you're African American, you probably don't even have it anymore. You've had a hysterectomy. But if you still have it, uterus at the bottom, that's the cervix. The cervix is the part that when you're having a baby, it dilates and opens so that the baby can come out. Well, that cervix has been found to be one of the number one places where we find cancer, cervical cancer. So we need to screen for that. The way that we screen is something called a pap smear. It's where you go in to your gynecologist or your primary care doctor, and they put you up in stirrups and make you feel all weird, and we take a biopsy. It's where we're just taking a little swab of the cervix. We send it off to the lab, and it's looking for abnormal cells. Now, some of you all may have had those cells come back, and they'll tell you, oh, you had abnormal cells, and we need to do further testing. That's where they do a colposcopy, which is a biopsy to further look at it. But the purpose of a pap smear is to screen for cervical cancer, because if left untreated, cervical cancer unfortunately could lead to death. Over the last 20-30 years, with advances in healthcare treatment and in screening, women are dying at far less rates than before. But in order to make that happen, we have to screen early. And that screening should start at 21 years old. I know way back whenever a woman became sexually active, they're like, oh, you need to go see your doctor and get yourself checked. Well, no, the guidelines have changed, because as we're still growing and developing, some young lady that's 14, 15, 18, 20 who's sexually active, her cervix is still developing. So it may come back as abnormal and set off a whole chain reaction of unnecessary tests when it's not abnormal cells. The body is still developing. So we recommend now that pap smear start at age 21, and if you've had a normal pap smear, then we repeat it in 3 years. If it's abnormal, then we'll do a biopsy, or it will be repeated a little more frequently, like every year. But abnormals in that 20 to 21-year-old range, we're not all that concerned about, because the body repairs itself. One very common finding on pap smear is HPV, which is human papillomavirus. I know some of you all may have children, and that's when they're getting an injection, even boys. Human papillomavirus has been linked to certain types of cervical cancer, or increasing your risk for cervical cancer. So that's one of the things that we screen for in a pap smear. But the biggest thing or takeaways we need to know today is, starting at 21 years old, every 3 years getting that pap smear. You can go into your local health department. You can go into Planned Parenthood. There's programs set up to pay for that, and also your primary care doctors, or if you want to see a gynecologist, you can see a specialist who will screen you for cervical cancers. Treatments, if something is found, we start, and there's services available that will do the biopsies, and then further testing to determine, is this a cancer, what's the necessary treatments, and the risk of death in relation to cervical cancer, if it's found very early, is very minimal, very minimal. There's no reason we should be losing any one of our sisters because of cervical cancer, because it's a simple test. It takes 2 seconds. I am the master. I will get one done in 30 seconds with my nursing staff. I'm with a patient today who's got a couple questions. What are your questions?
I would like to know, how often should I be screened for cervical cancer?
Every 3 years, starting at age 21, whether you're sexually active or not. And that goes for some of my ladies who I know, good church women who don't have husbands. You are keeping yourself, if you are between 21 and 64, every 3 years I need you in the office having a screening for a pap smear to screen for cervical cancer, because it could have been something from years ago, abnormal cells with history and smoking and things like that. So every 3 years. And then some women, if you're in a monogamous relationship, meaning you're married, and you and both partners are monogamous, then it's every 5 years. But at bare minimum, every 3 years.
Okay. What about if I have no insurance?
No problem, Bob. At the local health departments, they have programs. I know at every health department in the state of Florida, if you are over 50 years old, it is free. So ladies over 50, happy over 50, you can have a free pap smear and mammogram for being over 50. If you are under, you can also check with the Planned Parenthood. They have programs that will assist based on a sliding fee scale. There locally in Polk County, there is Central Florida Healthcare, and they have locations all throughout the county: Mulberry, Lakeland, Winter Haven, and they will see you on a sliding fee scale. Your primary care doctor, if they're a general practice, they can do it, or you can see a gynecologist, and some will work with you on a sliding fee scale. It'll be about $150 if you ever had to pay at a gynecologist. And then I'm just up the road a little bit here, straight down 27. Today we're filming here in Claremont, so if you don't have a primary care provider, you can give my office a call at 352-315-7990, and Miss Cheryl will get you scheduled. Any other questions?
No, I think that's about it. You really answered all of them.
Awesome sauce. Ladies, take care of yourself and each other.